Hello everyone, I'm Dr. Niti Raizada. I'm Senior Director of Medical Oncology and Hemato-Oncology at Fortis Group of Hospitals at Bangalore. I'd like to talk about blood cancers in general. So blood cancers are broadly classified as either leukemias, which are WBC related cancers. It could be lymphomas, which are lymph node cancers, or it could be myeloma, which is a type of WBC known as plasma cell, and it is a plasma cell cancer. Now, when we talk about leukemias, it has distribution across age group. And when we talk about young boys or young kids, acute lymphoblastic leukemia is the most common leukemia. We have acute myeloid leukemia, which happens in younger population, and of course also in more than 60-year population. The second subset of leukemias are chronic leukemias, which could be chronic myeloid or chronic lymphoid leukemia. So acute leukemias are a very interesting subset in which we say that quite a few patients can actually be cured if they are diagnosed at the right time and treated adequately. Some high-risk subsets will require bone marrow transplant, and in acute leukemias, the type of bone marrow transplant is known as allogenic bone marrow transplant, in which we try to use stem cells or a type of blood cells which is collected from siblings, which is known as sibling stem cell donor transplant. It could be unrelated donor transplant, which is known as matched unrelated donor transplant, in which we do HLA typing of the individual and try to find out if in any registry, whether it's an Indian registry or a European registry or an American registry, whether we have a compatible, perfectly matched, HLA matched donor as well. When we collect stem cells from that donor and give it to the patient who's affected and who's doing well with the previous therapy. Now, chronic leukemias are normally managed with biologic therapies based on what is the molecular signatures they have. Lymphomas are technically lymph node cancer, again happen in very young population or even in very old population. And again, at least a high grade lymphoma is called as technically curable cancer. So crudely, lymphomas are divided into non-Hodgkin's lymphoma or Hodgkin's lymphoma, and non-Hodgkin's could be high grade or a low grade lymphoma. Some of them also who have not responded in the first time or relapsed non-Hodgkin's lymphoma or a relapsed Hodgkin's lymphoma may require autologous bone marrow transplant, in which stem cells are collected from the same individual. After giving high-dose chemotherapy, these stem cells are given back to that individual. When we talk about myeloma, it is again a cancer which presents with 4 important things. It could present with renal dysfunction, anemia, calcium disturbances, and bone lesions. So these are the 4 things and 4 types of specialities in which a patient can present. So it could come to an orthopedician, or it can come to a general physician for hypercalcemia or anemia, or it could come to a nephrologist for renal dysfunction. So how do we diagnose myeloma? Well, basic bone marrow studies and certain type of blood panels confirm whether you have myeloma or not. And most often a combination of steroids with some type of biologic therapy is administered. Often patients who are transplant eligible, who are healthy and fit, will require transplant in such cases, and this transplant is again autologous transplant. Now, there is no technically age criteria. It could be 65 and below who will require transplant, but even in your 70s and your late 60s, if you are healthy and fit, you will be eligible for transplant, which requires about 15 to 20 days in which high-dose chemotherapy is given and the stem cell collected by you are given back to you.